Associate Professor of Department of Gastroenterology, Shanghai Hospital at the 2nd Military Medical University of Shanghai. Today, I will be discussing our article recently published in Endoscopy entitled Prophylactic Somatostatin Can Reduce Incidence of Post-ERCP Pancreatitis, Multicenter Randomized Control Trial. The co-authors include Professor Ren Xu, Zhang Xiao-Feng, Nong-Hua, Xue-Gang, Xin-JianWan, Zhan-Guo, Shu-Tang, Ping, Tian, Ming, and Professor Zhao-Shen. The idea of this study originated from my mentor, Professor Zhao-Shen, the director of Digestive Endoscopy Center of Shanghai Hospital. Our center is a national referral center, and we perform about 3,000 ERCP procedures annually. And we know ERCP is a complex procedure with a risk of complications such as pancreatitis, bleeding, and perforation. And the post-ERCP pancreatitis is the most common complication after ERCP. Despite of careful patient selection and improved endoscopic techniques, some patients still develop pancreatitis after ERCP. To reduce the occurrence of pancreatitis, somatostatin had been investigated for pancreatitis prevention in clinical trials. But after a literature review, Professor Zhao-Shen and I found previous studies had conflicting results, so it's not clear if somatostatin should be used before ERCP to prevent pancreatitis. So the purpose of this study is to determine the preventive effect of somatostatin on post-ERCP pancreatitis in a multicenter randomized control trial. This randomized control trial was conducted at 11 referral centers in China. During the study period, a total of 900 patients were included. The baseline information of the two groups of patients was comparable, and the indication for ERCP was mainly biliary disease, and more than 90% of the ERCP procedure was therapeutic. And one group of the patients were randomized to receive somatostatin intravenous bolus before ERCP, and the continuous infusion for 11 hours after ERCP. Another group of patients were randomized to receive no somatostatin at all. Overall, pancreatitis occurred in 52 patients, and 34 in the control group and 18 in the somatostatin group, and the difference was remarkable. And all the patients of pancreatitis had mild or moderate pancreatitis, and none of the patients required surgical or interventional treatment, and all the patients were fully recovered. For secondary outcome of hyperamylasemia, it occurred in 73 patients, and 46 in the control group and 27 in the somatostatin group. Again, the difference was remarkable. However, the overall incidence of pancreatitis is relatively low in our patient population, and this means not all patients need prevention, and we need to find out real high-risk factors for patients undergoing ERCP procedures, and only these high-risk group patients we need to give prophylaxis to them. And the second, recent study showed non-steroid anti-inflammatory drugs, NSAIDs, can also effectively prevent post-ERCP pancreatitis. So I think it will be very interesting to compare NSAID with somatostatin in a head-to-head randomized trials. Finally, this randomized clinical trial demonstrates somatostatin was effective and safe for prevention of pancreatitis and hyperamylasemia after ERCP. Thank you.